Welcome to my channel. I am Dr. Sridhar. Today I'll be discussing the recent sad incident in Madhya Pradesh in India where 11 children, young kids, lost their lives from renal failure resulting from use of a cough syrup contaminated with diethylene glycol as one of the components. Cough syrups, the usage is questionable. I've made many videos on over-treatment and how we can manage cough in children without using symptomatic treatment significantly. Most of the pediatricians have got used to a certain pattern of practice, so they're unwilling to change the approach, even though they know there is no evidence base and in fact it may be unsafe to use some of the cough medications. In this case, it's not only about using a combination medicine called Coldrix, which has phenylephrine, a decongestant, which is not supposed to be used in young kids due to cardiac effects, antihistamine and cough suppressant. So a combination of three medications in one, which most of the pediatric bodies don't recommend, and usage in kids below 2 years and especially the younger kids is still rife. So what are the reasons why this happens? One is the lack of quality control. There is a mushrooming of small pharmaceutical companies who want to make a quick buck, and they don't spend money on quality control. They cannot afford to spend money on quality control. The people whom they employ are also not adequately qualified, and they may take shortcuts in sourcing the raw materials. So for example, if a particular raw material which is supposed to be used is not available or it's more expensive, they may not have the knowledge enough to understand that the other raw material which they're sourcing, even if it has the same name, may have toxic ingredients, like in this case ethylene glycol. So we had cough syrup related deaths in African countries as well as Uzbekistan. Most of them were shipped from India as well. So even though India is progressing in many fields, the aspect of quality control is often missing. The government does have checks in place, but it's not possible to check every batch. And there is corruption which is rife, so they can easily bribe the officials who come to check, or they can substitute a sample which is being tested because they know in advance that a check is going to take place. They have people planted in the bureaucracy who can share the secrets with them of regarding when the raid would happen and so on. So first issue is regulation of the pharmaceutical industry, only allowing the manufacturers who have the ability to do adequate quality checks, ensure their employed personnel are adequately trained, at least the decision-making staff, and quality control down the road. The government should have more stringent checks when, for example, transferring from one state to the other. There should be an independent check in each state.